Hello, everybody. It's Dr. Eric Balcavage, and we're back for another edition of the Thyroid Answers Podcast. And as always, on the other side of the screen is my partner, Dr. Erica Riggleman.
Hello.
How are you?
I'm doing good.
Great. And so we've had a number of great guests in the last couple weeks, which has been awesome. And we learned a ton from everybody. But I thought it would be a good idea, and we discussed this, that maybe we start taking some questions that we get, and we do a little listener Q&A today. So I think what we're going to do is we're just going to go back and forth. We'll ask some of those questions that people typically have, and we get in our office through the podcast, and we answer some of those questions today. And whatever we don't get through today, we'll do an episode in the future. Okay?
And if you're ever watching this and you have questions that you're thinking about, comment wherever you're watching this, because we want to be answering the questions that you truly have, and so we can give you the answers that you maybe have been looking for.
And one other housekeeping note, and that is iTunes. If you're enjoying the podcast, and we know so many of you are because our numbers keep growing each month, please go to iTunes and put in a 5-star or whatever star review, because that helps us on our ranks on iTunes and keeps us there. So tell your friends, tell your family, post it on Facebook or whatever other medium there is. But what we're trying to do is help more people heal and repair and do as much as they can on their own. So we want to give them the answers that they're looking for. So spread the word if you're enjoying the podcast. So without any further challenges or problems or commentary, why don't we get into some of the questions that we need to answer for today? And so I'll give you the first one, and that is, this question is, how do I know if my symptoms are caused by my thyroid or my adrenals?
Very good question. That can often be a tricky one because the symptoms often very much overlay. You can have, the hormonal shifts can cause thyroid issues as well as obviously be an adrenal problem. You can have the fatigue, you can have the constipation, you can have all of those overlapping symptoms. And so there's no real easy way to know without truly testing. And so I would say finding a practitioner that knows how to truly test the thyroid and to test the adrenals to be able to distinguish between the two. I often see in my offices that there really is no distinction between the two. Usually when you're having a thyroid problem, you're going to have an adrenal problem. And when you're having an adrenal problem, you're probably going to also have a little bit of thyroid dysfunction. And so they kind of play off of each other. It's very rare that I see somebody have one or the other, adrenal or thyroid.
And I would agree with that. I think we know there's something called the hypothalamus pituitary adrenal axis. There's also the hypothalamus pituitary thyroid axis. So you might as well say there's a hypothalamus pituitary adrenal thyroid axis. All those things interconnect. We, in traditional medicine, oftentimes we compartmentalize and say, well, you have a thyroid problem and that's it, or you have an adrenal problem or that's it. And we often see that in functional medicine happening as well. People will compartmentalize, but none of these systems work on their own. They all tie into each other. And so Dr. Eric is right. If you have an adrenal issue, you likely have a cellular thyroid issue. Remember, you may not have a glandular problem, but you may not be getting sufficient thyroid hormone conversion inside the cells, and that's what's really important. So a functional medicine practitioner who really looks kind of in depth is going to probably take a look at your symptoms, kind of look at some assessment surveys, and then potentially do some testing to confirm which system seems to be more challenged, what's the best order to treat you, and more than likely you're going to be addressing both things.
Yeah, definitely. All right, next question, and this is a really good one. What is the best diet for hypothyroidism?
So that is a loaded question, but it gets asked so much, and I think we're probably in agreement with this. The best diet, and it doesn't matter if you have a hypothyroid condition, any condition, or you're just looking to improve your health, a whole food, real food, in-season diet is probably the best for overall. So eat lots of veggies. I say if you divide your plate into half your plate, split it in half the plate should be really lots of vegetables. The other half should be about a third protein, about a third healthy fats, and that last third plus or minus carbohydrates in the form of berries and fruits, and lower amounts of starchy carbohydrates. how much of those starchy carbohydrates you need or you need to be taking into your diet really depends on your activity, whether you're ketogenic, not ketogenic, and everybody's got to kind of fine tune that piece. But by far, the biggest cause of chronic health problems in this country is an overconsumption of carbohydrates that we just can't use. So I think most people would benefit from a whole food diet that's kind of laid out that way. If the paleo group and the vegetarian group got together, got married, it would be somewhat of a blend to that. But we have these dogmas too often where you get the people that are vegetarian or strict vegetarian and no meat is good, and that's not necessarily the case. And then you have the people that are paleo and are way off and they're only eating fat and protein and not eating enough vegetables. And I think life doesn't happen at the extremes. It really happens somewhere in the middle. So I think that type of a blend of a diet. And then if you want to tweak it with like intermittent fasting or push a little bit of more of a ketogenic state, that's a choice, but that also is going to take some time to get used to. But I think if you ate that whole food diet and did some intermittent fasting, whether it's an 18-6, fast for 18, eat in that 6-hour window, or anywhere from a 6 to 10 hour window, if you kept your food intake at in that space 3 to 5 times a week or more, you'd probably be really pretty healthy.
Yeah, I don't think that you should ever be truly married or really stuck with one form of diet. And a lot of people get stuck on these diets, whether it's the autoimmune paleo or it's the ketogenic, and they're 100% married to it and they never deviate from it. And you often end up eating the exact same thing every day. And you often become nutrient deficient because you're not getting that variety. And I think depending on your stress level, your activity level, the seasons, I think that your diet should vary to some degree, but I think there's one big thing that you really should be avoiding, and it's going to be obviously processed food, processed sugar, things that create inflammation. You want to be focused on more anti-inflammatory types of foods.
Yeah, and I think that's where the big argument lies, right? If we just got rid of most of the processed food and ate like we discussed, 80% of the people would be healthy. The craziness is you got two camps, both focused on eating healthy, a lot of times arguing with each other about which is better. Well, that is really the last minutia of how you need to fine tune things. For the vast majority of people, unless you've got some real significant health crises going on, or you're an uber athlete, 80% of the time, eat a really kind of the diet like I explained. And 20% of the time, I think you should also enjoy yourself. I don't think that people need to be, oh my gosh, I can't ever have this, because that creates more stress and worry that they're going to screw up somehow. I tell people, listen, 80% of the time, eat real good, eat real clean, and your body's adaptable. It will be able to manage stuff. Now, that may not be the case when you're already chronically ill, but once you get yourself to a state of feeling pretty well, you just take care of yourself, eat the majority of your meals really well, and then enjoy things periodically. The problem is we get that shift where 20% of the meals are healthy and 80% are full of junk, and that's why we wind up getting sick over time, right?
I think some of my patients, they get stuck in these ketogenic or paleo type of diets, and they're afraid to get outside because they start to see the improvement, and they're afraid that if they step outside of ketosis or even the ketogenic diet and eat any sort of carb that they're going to feel terrible. But you have to have metabolic flexibility in your body. If you eat one little bit of a carb and it throws your whole entire health out the window, then there's something still broken metabolically. And so you kind of want to take a step back and say, can your body be flexible enough to be able to manage and kind of shift these throughout the year and throughout the seasons? Right.
And so it's good to, there's lots of guidance out there as far as eating kind of how we explain, but real food diets, if paleo and and primal eating is one of those things that you can be a great guide, but that blend works really well. And then if you want to ease into a intermittent fasting, there's plenty of guides to do that, but just ease into it. Don't go like cold turkey right into those things, because your body will get shocked when you transition into dietary things. That quick, by changing tomorrow and making that aggressive change, you can be ready for some nasty side effects if you do it too aggressively, right?
Yep, absolutely.
All right, so let's get to the next question. And this question was, I've been reading about raw vegetables and the potential damage to my thyroid. Is this true?
Yes, I mean, there is research out there that shows that, raw cruciferous vegetables can potentially create some thyroid disruptions. From what I have read in the research is that the amount that actually can cause that is astronomical. Most people would never be able to eat that amount of raw vegetables. And so I would not avoid raw vegetables. That's not a reason to avoid your broccoli and, your other cruciferous vegetables, but you want to maybe not have boatloads of raw. You want to throw in maybe some raw, cooked, steamed. You don't want to avoid vegetables because they have a purpose. But the amount that you would have to eat to create a negative response, I think you're going to get more damage by eating, a cookie or a muffin. You're going to get more inflammatory response than if you were to just sit there and eat, a little bowl or a little cup of, raw vegetables. And
I would agree. I mean, if your biggest concern is, am I eating too many raw vegetables? You're in a great place because that means you've cut out excessive amounts of processed pasteurized dairy that maybe is creating disruption. You've cut out most of the sugar. Mm-hmm. You've cut out most of the grains and the other processed food and the artificial sweeteners. Those are the things that are more concerning and more important to worry about when it comes to thyroid function and driving autoimmunity. The cruciferous vegetables that are maybe raw, maybe cooked, but could they be a problem? That is probably on a scale of 0 to 10, your concern if you've got hypothyroid issues, that's probably a -1. Your primary concern should be eating good, clean, healthy, whole food first, working on good digestion, which means, without any vitamins or enzymes or anything, just making sure you take time to eat, you slow down to eat, you chew well, you don't drink a lot of fluids with your meal. Make sure you're doing what you can to improve digestion. You want to make sure that you are exercising or active every day. You want to make sure you're working on sleep quality. Those are the things that should take up most of your thought process when you're trying to get healthy and well, not am I eating too much raw vegetables.
Yeah,
okay?
I actually had a patient come to me a few months ago who her endocrinologist told her to avoid all raw vegetables. She should never eat a salad. She should never eat anything that is raw.
Yeah, I think it's a doctor just is not up on what's going on, right?
So sometimes you have to take a step back and say, okay, they're telling me to avoid a vegetable. Right. Obviously there could be that potential, in large amounts, but you have to kind of look at their training and their knowledge of nutrition. And, they're just looking at guidelines and standards. They probably read one article and didn't really realize the amount that you would actually have to eat. And so sometimes you have to take that with a grain of salt.
Yeah, sometimes you have to read more than the abstract, right?
Yes.
In a research journal to understand what it's saying.
Yeah.
All right.
Next one. Is it true that reverse T3 blocks thyroid receptors?
So let me say that I have said this because I was taught this in the past, but because it's been brought up and I've said it and I've done a lot of research on this, I don't think that that's really what happens, okay? And so what happens is that reverse T3 is really made inside the cell with the conversion of T4 to T3 by an enzyme called deiodinase 2. And so if reverse T3 is going to be made, it's usually made by deiodinase 1 or deiodinase 2 on the membrane of the cell, not inside the cell, inside where the closer to the nucleus. So the reality is there isn't research that really states, and I've scoured the stuff, and if you have a different response to that, let me know if you've seen it. It was what I was taught, but that doesn't mean that it's backed up by the recent research. Now, maybe nobody's doing that research, but what it turns out to be is that once T4 gets into the cell and into the endoplasmic reticulum, part of the cell, where the deiodinase enzyme typically hangs out, that's where the conversion occurs from T4 to T3. Deiodinase 2 does not convert to a reverse T3, so it only converts to T3. So if there's a state in the cell where there is going to be conversion to reverse T3 by D1 or D2, that's probably going to be affected at the cell membrane, and we're not going to see higher concentrations of reverse T3 in the cell. We'll see it in the serum, but the reverse T3 has not been found, at least in all the research I've read, to be actually blocking. But it does require active thyroid hormone to bind to these thyroid response elements inside the nucleus to stimulate metabolism. So even though I may have said that in the past, I'm not sure if you've said that in the past. It's something that I've been taught in the past, but in doing a bunch of research, I haven't seen it. So that's I was asked that question, and I want to make sure I answered that. Okay. Any thoughts on your part on that?
I mean, I see it a lot. I mean, I think just like you said, there isn't a lot of the research out there. I'm seeing more and more reverse T3 high in the body when all the other thyroid markers are completely normal. I mean, it's more and more that I run that test, I'm seeing it. And so it does raise question of, okay, what's truly going on here? You know, at the cellular level and in, you know, obviously in the blood.
So it is possible that you could have elevated reverse T3 because the same mechanisms that are going to increase conversion to reverse T3 and deactivate thyroid hormones would be the same mechanisms that could create some change in D2 physiology. Okay, so there's some complicated chemistry there. Maybe that will change, but right now, based on all the research I've read recently, it does not appear that reverse T3 actually binds inside the cell to the nucleus and blocks the reception. What's probably happening more is that T4 isn't getting converted to T3. More of it's getting converted to reverse T3 before it really can get into the cell, or it's getting converted right at that cell membrane level and then getting back out to the bloodstream. So that would make sense that, hey, all the other markers are good. I'm hypothyroid because that T4 isn't getting into the cell. It's not getting to the nucleus. It's getting converted. And the other thing is that most of in a lot of the tissues, I should say, the T3 that's used to drive metabolism is intracellular T3. So it's actually conversion of T4, T3 inside the cell. And so that's really important. And there's a number of mechanisms that can decrease deiodinase 2, things that can cause ubiquination of deiodinase 2. So we won't get into that complicated chemistry. But as far as I'm stating right now, based on what I've seen, what I've read, there is increasing T4 can definitely create some problems. If there's broken machinery, it can definitely increase reverse T3, but it may not be a blocking mechanism of reverse T3 at the T3 receptors in the nucleus that actually trigger the symptoms, but we may see those elevations. Okay.
Now, in your research of the reverse T3, are you seeing that there's evidence that in a kind of a stress state, whether that's a physical stress, an emotional stress, a pathological stress from a pathogen, is that making you make more reverse T3? Did you find that in any of your research?
Yeah, so stress responses will drive up that downregulation. Now, what's interesting is that in certain stress situations, in early stress situations, thyroid hormone could actually stimulate autophagy. So autophagy is, so for the listeners, autophagy is our body's kind of cleanup process. So when there's a stress on the body and there's a lower energy state, and especially if there's short durations, the cell will actually say, okay, I don't have enough energy to do what I need to do, so I'm going to start cleaning up the debris. I'm going to look for sick organelles. I'm going to look for lipids and fats in the cell to start catabolizing for energy. T3 is critical to triggering autophagy. So as you get more T3 in the cell, you'll increase autophagy. That works well in the short time frame. But I think when it's the chronic stress response, that chronic cell danger response that we've talked about in the past, where you really get reduced energy levels, then thyroid hormone transport and conversion really becomes downregulated. And then without T3, autophagy does not work efficiently, and beta oxidation, or the burning of fats, doesn't work real well either. I know there's a listener question later that I'll jump into that and kind of explain that a little bit more.
Okay.
All right, so next question for you is, I've got Hashimoto's, and people keep telling me, and I keep seeing it on the internet, that I need to change my diet. What does diet and changing diet have to do with improving Hashimoto's? Why is it so important?
Oh, well, that's a great question. Hashimoto's is very much an indication that, diet needs to be looked at because it's an autoimmune disease. We've talked about autoimmune disease on the podcast before, but most autoimmune diseases are going to begin inside the digestive tract. That's where autoimmunity, 80% of your immune system is going to reside there, where you may be the initiator of an immune response. And there's a lot of research out there that there are molecular mimicry to certain foods against your thyroid. So if you already have antibodies to your thyroid or thyroid hormone, and you eat these foods that have molecular mimicry, your body may think that those foods are actually your thyroid tissue and actually create an immune response. And specifically, obviously, gluten and dairy are going to be the two biggest ones that have that molecular mimicry. And so diet definitely is a key player when it comes to Hashimoto's and any sort of autoimmunity.
Yeah, and I think we hit on that before, and I think the thing we have to be careful there too is that people who hear the message, whether it's on Facebook or the internet, and if you have Hashimoto's, you need to be gluten-free. I caution people on that. Mm-hmm. I really think they really need to be lower on processed foods, lower on carbohydrates, not just necessarily gluten-free. And you know that this as well as I do, that what happens is that some people just go from a high carbohydrate that's gluten-based to a high carbohydrate diet that is not gluten-based, but it's got a bunch of artificial or frankenfood kind of substances in there to make it taste good or rise or do whatever it needs to do. So these aren't really better quality foods. Yes, they may not have gluten in them, but they may have other foods that could trigger chronic inflammation in the GI tract. And it's that chronic inflammation and the chronic carbohydrate loading that can drive inflammation. It can drive bacterial and yeast overgrowth. And once we start getting enough damage to the tissues, that inflammation can trigger autoimmunity, or you get enough damage to the cells where the cells themselves start to break down. They go through that cell danger response we've talked about in the past, and some of the products that are released from those damaged cells actually trigger autoimmunity. So the cell itself, as it breaks down, may trigger its own autoimmunity. Yep. That can happen in the thyroid gland without any immune cells. And then the last piece of it, if you have a diet that's very high carbohydrate based, crappy or lousy types of fats that you put into the system, and you get overgrowth or dysbiosis, the organisms can get into the lymph tissue. They can get directly into the thyroid gland specifically because of the direct route of entry of the lymph tissue. And that infection can induce autoimmunity right into the thyroid gland. So yeah, really important that if you have Hashimoto's, that you start improving your dietary choices, not just gluten-free, but definitely that healthier lifestyle. They can let's call it an optimized diet, which is high in vegetables, and then mild to moderate amounts of protein, moderate to mild amounts of healthy fats, and mild amounts of healthy carbohydrates, right?
Yeah, absolutely.
All right. What's next?
Next one. I'm on a low carb, high fat diet, and I'm not losing weight. What is going on?
All right. So this is a great question, and it's got multiple prongs to it. So if you've got immune inflammatory issues and you just switch from low carb to high fat, there's a couple things there. That is fantastic, but you could have cellular hypothyroidism without thyroid hormone in the cell. We just kind of talked about this, so this is a great next question. Without sufficient thyroid hormone in the cell, you can't induce beta oxidation, which is the conversion of fats into the mitochondria for energy. So when you have plenty of glucose circulating around the tissues, then the body's not going to use fats. It's just not. So you're going to get fat accumulation in tissues, but the body doesn't need to burn fat. Going low carbohydrate is awesome because then your body says, okay, I've got lower carbohydrates. I need to generate some energy that stimulates to some degree this autophagy and what they go lipophagy. So the body the cell itself starts to produce, starts to engulf fat molecules, and then converts those fat molecules into energy, and delivers, or it takes those fat molecules, breaks those fat molecules down, and uses a process called beta oxidation to generate energy in the mitochondria. But both the autophagy, the utilizing or attacking these lipid cells, and beta oxidation both require thyroid hormone in the cell. So if you're doing that, your low carb, high fat diet, and you're saying, I still can't lose weight, then there still may be cellular thyroid problems. And that's where both Dr. Eric and I talk about running full thyroid panels. Because as we just mentioned, if you're taking thyroid hormone and you're doing these other things, but your reverse T3 levels are elevated, yeah, you're converting the T3 into more reverse T, or the T4 into reverse T3. The T3 is getting converted into T2. You don't have sufficient intercellular T3 to drive metabolism. The second piece of that is the issue that caused your problem to begin with at the root is an inflammatory condition. And so if you just eat less carbohydrates, increase fat intake, the machinery doesn't work, and I still have inflammation going on, you are going to continue to have the problems because the inflammation is not going to allow the conversion of T4 efficiently to T3. So that's going to be a problem. So that is something you want to address. Where's my inflammatory or my stress mechanism coming from? Are you excessively exercising, like way overdoing it or doing it improperly? Are you not getting enough rest? Do you have emotional stressors in your life that you are either aware of or just you subconsciously are driving problems for you? So you have to get to what some of those stress triggers are that are still creating a problem. Even toxicity issues in your environment, whether it's water or air, have to be looked at. So it's not just a matter of, well, I'll just eat less carbs and eat more fat. There's still a piece of the machinery that's being compromised. So we have to dig into that a little bit more. And exercising even harder is probably not the answer, right?
No, it's definitely not. I agree that the toxicity of your environment, the toxicity of your body has to be looked at, because a lot of those toxins are going to be, fat soluble. They're going to be in the fat cells. And so if you're not able to process toxins, your body often doesn't want to lose fat cells. And that I often see with people who are going on a low carb, higher fat diet. They're either eating way too many calories and still storing that as fat, or the other side of it is that they don't know what to eat on a low carb, high fat diet, so they don't eat much at all. They're eating more of a low carb, no fat diet, and they're only getting maybe 500-600 calories per day. And again, that's going to push your body into more of a, slowing of the down, because you're not getting enough calories to stimulate the metabolism.
Right. And that kind of ties into, and I want to make sure people don't get confused when I talk about intermittent fasting versus starvation diets. Just started a patient who was on a medical weight loss program, and essentially their calorie load was under 1,000 calories a day, and part of that was these protein bars, which were the first 6 ingredients were sugar, right? And so you go, what's going on here? It has been shown in the research that short-term periods of caloric restriction are very beneficial for health. And whether that's a multi-day fast or a eat one day, don't eat the other day, or like have an 12, 16, 18-hour fast and then shorter periods of eating, all of those seem to work, okay? The more aggressive you get, if you do a 4 or 5 day no food, water fast, are you going to kick yourself into ketosis much quicker? Yes. But that is not a long-term process. That's usually get myself into ketosis and then go into this kind of ketogenic eating pattern. But when people constantly and continuously eat really, really low carbohydrate, that has a different impact on the physiology than intermittent fasting. So if you're constantly snacking little bits of food through the day, but you're eating less calories, that has not been shown to have the same benefit as eating the same amount of calories or even a little bit more calories in a restricted time frame.
Yeah, and I think it goes back to a fed state versus a fasting state. And so a lot of people who go on low calorie diets, they again, they're eating low calorie, but they're eating all day long. They never get into a fasted state. You can, restrict your food eating to, even a 6-hour window per day, or even go to a 24-hour fast. And that actually spikes your metabolism. Research shows that if you go 24 hours without eating, you actually see an increase in your metabolism. But if you eat a low-calorie diet for a period of time, but eating all the little bits here and snacking every couple hours, that has actually been shown to decrease your metabolism over time. And so a lot of people think if they skip a meal that they're going to ruin their metabolism, and it's actually the complete opposite. It's eating little meals here and there that over time destroys your metabolism, versus if you were to actually do some intermittent fasting, actually can see some, boosts in your metabolism itself.
Right, and that chronic eating also plays into chronic health issues as well, because if you're constantly eating, then your bowels aren't moving as efficiently, because your bowels kind of become inactivated for about 90 minutes after a meal, to allow for the process of digestion to start. And if you're constantly eating, then your bowels get slower and slower and slower. And then the less your bowels move, the more bacterial overgrowth and yeast overgrowth and dysbiosis you get in the bowel, which produces more toxins, which creates more insulin resistance, which creates more inflammation. And now you start gaining weight. So it really doesn't work the way we were all taught, was, eat, every couple hours was one of the things we were taught to help regulate blood sugar. All of that really does is maintain you as a carbohydrate burner, and really put you in a dependent state. And it's really a recipe for poor health, not a recipe for good health. So I know we're looking a little bit off tangent, but that's a real important point, and I'm glad we got to cover it.
Yeah.
So next question. This question is, I don't have a doctor or insurance. What symptoms might indicate I have a thyroid problem?
Okay. If you're not having a doctor, you're not getting regular checkups, there's some big things you want to be looking for, is what's the health of your hair, your skin. You want to be listening to your body. If you're, gaining weight, that is an indication that you may be having some thyroid issues. Another one I see is body temperature. Are you fluctuating between hot and cold all times? You can even take your body temperature to see if your body temperature is a little bit off than, what the average body temperature should be. Maybe you're constipated. That's a common one. And these symptoms often are just kind of pushed to the wayside, where people kind of ignore them. They think it's normal. You could have anxiety. You can have depression. The list can go on and on. The best thing is if you're having some unusual symptoms, or symptoms that should not be currently happening, especially if you're, in your 20s, 30s, having those symptoms, maybe that's time to actually find a doctor to run some testing, just to make sure that you are a normal. If you're even having to think you have a thyroid problem, it's probably an indication that you may have a thyroid problem that you want to get checked out.
Yeah. And I would say thyroid hormone, you have to keep in mind that thyroid hormone touches every cell and every metabolic process in the body. So if you have almost any symptom, there's an indication that thyroid physiology at the cellular level is likely compromised. Whether if you have reflux, major cause of reflux can be cellular hypothyroidism, because you can't make sufficient stomach acid. If you've got constipation, as Dr. Erica was saying, thyroid hormone plays a role in motility of the bowels, so it's really important. If you look at skin or hair quality or energy level, or you're storing fat, or you're just more tired, more fatigued, any symptoms of lower or reduced energy is definitely an indication that your metabolism is slowed down. It's probably worth getting looked at by a physician to find out if you have a thyroid problem. And we talk about this all the time. Make sure that you understand, because your doctor, if you go to a conventional medical doctor, and even some functional medicine doctors, are going to consider a thyroid problem a problem when the gland is bad. That is glandular thyroid issues. One of the things that happens well before the gland can go bad is that you can have hypothyroid symptoms at the cellular level. Does that mean you need thyroid hormone? No, it's just a clue that, hey, my thyroid physiology is being altered at the cellular level. I have hypothyroid symptoms. That's where a functional medicine practitioner like Dr. Erica and myself is going to say, okay, what would be inhibiting appropriate thyroid physiology at the cellular level? Is there some type of heavy metal stress? Is there some type of inflammatory mechanism going on? Is there blood sugar dysregulation? Is there infection, bacterial, virus, or yeast that can be triggering this stress response, which may be actually reducing thyroid conversion into active thyroid hormone that's slowing metabolism, increasing reverse T3. So if you have any of those symptoms, you want to get looked at. A, rule out the overt glandular problem, but B, then you have to take a look at, okay, what's happening at the cellular level.
Yeah, absolutely. Do we got time for one more question?
Sure. If you tell me. You keep
Yeah.
in the clock, so that's good.
Let's see. My doctor says that although my symptoms are very similar to hypothyroidism, that he is saying that my issue is depression. Is that possible?
So, what happens many times is that people have all the symptoms of hypothyroidism. Doctor would agree. They'll run TSH and T4. Those values may still look normal. And so they'll say, you know what, your thyroid gland is working. And he's probably correct. The gland is probably working. But the conversion into the cells is probably not efficient. And whatever's causing that to occur is triggering some level typically of inflammation or stress response at the cellular level. Anytime there's a stress response kicked in at the cellular level, serotonin, which is the feel-good neurotransmitter that kind of helps us stay happy and feel good, is going to be reduced. The levels will, tryptophan, which is used to make serotonin, will be converted to something called quinolytic acid and kynurenic acid, which can increase neurotoxicity, so that can give us a brain fog, fatigue, and some of those symptoms we associate with hypothyroidism. And the body will more rapidly deplete the serotonin that is made out of the body. And so we get reduced levels of serotonin available. That can make us moody and irritable and not want to be around people. And so, yeah, is that depression? It absolutely is depression. Sleep could be not maybe as restful because of there's decreased melatonin conversion as well. But is it depression and does it need to be treated is a different issue. The question is, if you have those symptoms of depression, there's something that's driving it and triggering it. Mm-hmm. And so that's where conventional medicine and maybe functional medicine may differ. Your doctor may diagnose that as depression. That it would be a good definition of depression. I'm tired, I'm depressed, I don't feel good, I have low energy. Yeah, somebody could diagnose you as depression. Remember, depression is a made-up name for a group of symptoms. But sickness syndrome, which is essentially what that is a normal response to chronic stress. And so instead of suppressing it, probably what we should be doing is asking the question, well, what would be causing my serotonin to be depleted or me not make serotonin? And that's usually some type of stress mechanism and some type of inflammatory mechanism. So do I have blood sugar dysregulation? Do I have chronic emotional stress? Do I have some type of heavy metal toxicity or chemical stress in my system? Or do I have some type of microbial stress? And I have to address those. The other thing that's really important is that when you upregulate the clearance of serotonin during these stress responses, you deplete riboflavin in the body. So riboflavin is needed to go through that reaction. So as riboflavin's depleted, it's not there to do a whole bunch of other things. And we talked about beta oxidation and the ability to utilize fat. Well, if you don't have sufficient riboflavin, then you can't go through beta oxidation. You can't use that high-fat diet to make energy. The other thing is that process of quickly depleting the serotonin out of the system uses an enzyme called MAOA, and MAOA, it needs riboflavin for that reaction to occur, which is why it can be depleted, but it can also increase the production of hydrogen peroxide. Hydrogen peroxide becomes a reactive oxygen species, so that triggers more inflammatory damage in the cell, decreases our mitochondrial production of energy. So you are going to feel tired and fatigued. It is all part of a natural sick response. So your doctor is right. We can call that depression, but it doesn't need to be treated necessarily with medications. What we need to do is put our doctor hat on and start asking the questions as to why is my patient feeling this way, right?
I agree. Absolutely.
Okay. You want to go more or are you good? I think we need to round it up.
I think we could round it up. I think we'll have plenty to do another Q&A session, maybe in a couple weeks.
Episode.
Yeah.
Awesome. So I think that was great. We got a lot of good information out. These are questions that people want to know answers to. So we encourage you that if you're listening to this or watching this, however you're seeing it, and you have your own questions you want to ask, put it wherever you see the video or wherever you listen to it, or reach out to Dr. Erica at her office, or reach out to me at my office or one of my websites and ask us what your question is. And we'll hopefully get that question on a future Q&A podcast. So as always, we appreciate everybody listening. We appreciate all the feedback we get, all the reviews on iTunes, and we really enjoy doing the podcast. We've got some great guests coming up in the future, and we've had some great podcasts so far. So we'll wrap this up by Dr. Erica. You let everybody know where you are and how they can get a hold of you.
You can find me and obviously my husband, who we're both doctors who work together. You can find us at DRS Riggleman. That's on Instagram. You can find us on Facebook, and then it's drsriggleman.com as well.
And you can find me at chronicconditionrecoverycenter.com. I also have a website dedicated just to thyroids called the thyroidproblemsdoctor.com. And I do pretty much every Thursday. I have a YouTube or Vimeo video called Thyroid Thursdays. I almost forgot. Where I talk about some aspect of thyroid physiology. Sometimes it's fairly simple and easy stuff, and sometimes it's a little bit more complex. So we do get there's a good mix for the doc and for the layperson to understand a little bit more about thyroid physiology. So we'll sign off. Dr. Erica, as always, thanks for being part of the podcast, and we will catch up on the next podcast.
Yeah, awesome. All right, I will see you on the next one.
Take care.
Yep, bye.